Hello, this is Congresswoman Joyce Beatty, and I want to welcome you to the first district-wide teletown hall meeting for the 3rd Congressional District of Ohio. Thank you for taking time out of your busy schedule to be on this call to hear about the 3rd Congressional District, what's happening in Washington, D.C., and to discuss important issues. But before I get started, I want to convey some information that will assist you while you're on our call. We will try to have ample time for questions and comments during the question and answer segment. If you have any questions, this is very important, please press 0 and a live person will come on the line and assist you. Also, it's very important for me to note that we want you to be aware that the call is being taped in order for us to post it on our website for individuals who were not able or available to join us for the call. First, I'd like to begin this evening's call with an update on our first 8 months in Congress. Then we will have a dialogue on some issues that are pressing in the district and Washington. I want to hear your comments on issues like the president's strike on Syria, ensuring the stability of early childhood education and higher education tuition, and the next phase of the Affordable Care Act implementation, the enrollment phase that will begin on October 1st. In fact, joining us on tonight's call is Michaela Monahan, the Regional Outreach Director for Health and Human Services, and she's from Chicago. And later, I will give a more proper introduction to her as we have the discussion on the enrollment period. With that said, good evening. I understand that we have a large number of folks on the line, so we are very pleased about that. I'd like to share a little about my congressional journey and what we have accomplished in the last 8 months. First, I serve on the prestigious House Committee, Financial Services, and subcommittees, Housing and Insurance, and Oversight and Investigation. I've had the opportunity to give opening statements. I've sat with some of the most prominent financial gurus in the country. We have responded to a total of 12,805 correspondences. This includes emails and fax and postal mail and telephone calls, hopefully from many of you. 31 public laws have been enacted in the 113th Congress. There have been 444 roll call votes on the House floor of the House of Representatives. And I've had the opportunity to participate, thanks to you calling and writing in and telling us your opinions, in a number of press conferences, including areas and issues like violence against women's press conference. Also a press conference for the Women's History Month, the 50th anniversary of the Equal Pay Act press conference, the Democratic Women's 2013 Economic Agenda press conference, the Congressional Black Caucus press conference meeting after meeting with the President of the United States, and most recently, the NCAA Act press conference, which you'll hear a little more about, which is my latest piece of legislation. I've even had the opportunity to deliver 1-minute floor speeches, and I'm very proud to say some of the stories and the things mentioned in those speeches came from you, ranging for advocating for nutrition, the SNAP program, known to some of us as food stamps, protecting Medicare for our seniors and those who are disabled, and keeping tuition costs affordable. I've had the distinct honor of leading the Pledge of Allegiance on the United States House floor and listening to the first female president of Korea to speak. Let me just lastly share that I have participated in a number of bipartisanship activities, group appearances with my colleagues on the other side, joining in legislation, even participating in the Women's Softball League, which the dollars went to cancer, and coming up playing in the charity Congressional Tennis Tournament. I have visited the New York Stock Exchange, the 9/11 Freedom Twin Towers, the site of the 9/11 bombing, and even seen the network stage of Saturday Night Live. I have visited the White House for presentations given to the Columbus Museum of Art, receiving the National Medal for having one of the best museums in the country. I have been there for a number of other receptions and even on the White House lawn for the Easter egg roll. I have invited and taken members from the community to Washington because I made a commitment that not only would I go to Washington, but I would take Columbus to Washington. And now I am excited to say we are inviting members of Congress to Columbus. I had a personal honor of participating in 2 marches. The enactment of the 100th anniversary, tracing the steps of our founders of Delta Sigma Theta sorority, which was the only group of women of color to march in the Women's Suffrage March, and most recently being there participating in the celebration of the 50th anniversary of the March on Washington. D.C. visitors, thank you to my constituents. You have come from all walks of life and from all areas of interest. We have had our office packed on many a days with educators, with children, with healthcare advocates, financial institution individuals, agriculture, members of sororities, bikers, retailers, restaurateurs, home builders, nurses, unions, medical folks, and the folks in the arts. Some have asked, why a teletown hall? What are we doing in person? Let me share that getting geared up for this teletown hall meeting, we have held many specialty town hall meetings in our district office and at on-site in facilities in the community. Just to share a few, last week, 31 members of unions were here to talk about issues. The following day, we had high-level administrators and staff from financial institutions in the district. We had a group to come to us and talk about immigration issues. Off-site, hundreds of people gathered at Children's Hospital to chat with us. Nationwide Insurance streamed live our meeting to 9,000 employees. I even went to White Castle and toured it and actually served burgers to members in the district. The Ohio State University, the King Arts Complex, the Bexley Chamber, and the Columbus Chamber of Commerce, and the Sheet Metal Workers Unions, and the list goes on. So now let me share with you where we are located. We are located in the Cannon Building in Washington, D.C., the oldest office building of the 3. 417 is our office number. And we are located at 471 East Broad Street, right here in the heart of the 3rd Congressional District. I am staffed with a strong legislative team, outreach team, case management team, and we are providing hundreds and hundreds of responses weekly to our constituents. We are small, but we are mighty, and as you can see, we are very busy. Thank you. Now, I would like to kick off, before we start asking the questions, with the issue that has been most pressing to us in this great nation, and that first topic would be Syria. I would like to talk about it because most of you are aware that evidence has come to light that the Assad regime in Syria used chemical weapons against its own people, killing some 1,000 adults and 400 young children. President Obama said the United States should take military actions against Syrian President Assad for using chemical weapons on civilians, but he has now also turned to the Congress to approve military actions against Syria and to hold Assad regime accountable, thinking it will also deter this kind of behavior in the future and degrade their capacity to carry out these types of attacks. Over the Labor Day weekend, I participated in a conference call with our top national leaders, all of whom discussed why the strike is necessary and warranted. I just returned last evening from Washington to participate in a bipartisan classified briefing with members of the Senate and the House to continue to gather facts on the situation, to ask questions of the administration, and to examine the evidence. I do not take this decision lightly. I am weighing the President's request for military actions while at the same time listening to my constituents. I have heard from many of you on this matter and will take your opinions certainly into consideration before making any decision. Tonight, I welcome your comments during the question and answer period. I would like to make sure that you are reminded that we would like you to press 0 if you would like to make a comment, and a person will come on and assist you. And we will do that during our question and answer. Education. I believe education is the economic engine to the future. It is necessary for us to assure that our young children receive the best education possible. And I believe that starts with early childhood education as the foundation. The beginning years of a child's life are critical for building the early foundation needed to success later in school and in life. President Obama said in his State of the Union speech, if states make it a priority to educate your youngest children, studies show students grow up more likely to read and do math at grade level, graduate high school, hold a job, form more stable families on their own. We know this works. So let's do what works to make sure that none of our children start the race of life behind. I applaud him for that and would like to hear your opinions on education. And lastly, the Affordable Care Act. With a month to go before we launch the major portion of the Affordable Care Act for the uninsured, those working and wanting to change their insurance, or those who don't get coverage through their work. A key component of the Affordable Care Act will take effect on October the 1st, when the new health insurance marketplace opens for business, allowing millions of Americans to comparison shop for a variety of quality health care. And you can go on to healthcare.gov website for coverage that begins January 1st. And we'll hear more from Michaela about that. And now it is my pleasure to introduce Michaela, who, as I mentioned before, is Ohio's Regional HHS Outreach Director. She is in Chicago. She is a health insurance specialist for the Center of Medicare and Medicaid Services. And as we know, Ohio is in the lead for health insurance marketplace outreach and education. Michaela, are you there?
I am here.
Okay. Please go ahead and share some opening remarks, and then you will be available as we get questions from those who are online. And again, I'm going to remind our folks on the call to not forget to press 0, and a person will come on and help you. Okay.
All right. Wonderful. Well, first, I really would like to thank you, Congresswoman Beatty, and your staff for having me here this evening. And I also would really like to thank everyone on the call for taking the time to join us tonight for an update on the implementation of the Affordable Care Act in Ohio. So I want to let you know that currently we are estimating there are 1.4 million uninsured individuals in the state of Ohio who are now going to be eligible for insurance through the health insurance marketplace. So the good news is we are on track and on schedule for the marketplace to be open for business, and it will be fully operational to enroll consumers in Ohio on October 1st of this year, which is only 27 days away from today. At the moment, the agency's goal is really to concentrate our outreach and education efforts on building the infrastructure for customer service so we can make sure that consumers in Ohio have access to help when they need it to help choose health insurance and understand what options are available to them, and also to help build the awareness around the health insurance marketplace, whether that's through in-person activities or social media or other venues. So a couple of updates we have. At the beginning of April, our agency, the Centers for Medicare and Medicaid Services, began accepting applications for qualified health plans. And these health plans are private health plans that are offered through the health insurance marketplace for individuals who are looking for coverage. And the marketplace's goal is really to have clear information about the plan costs, whether that's the monthly premium, what your deductibles might be, or what your out-of-pocket costs might be at the point of care. And this is going to allow a consumer to have apples-to-apples comparison of what those costs and coverage will be from the variety of health insurance plans that are offered. Because Ohio is a federally facilitated marketplace, CMS has been reviewing the applications of those who wish to be a qualified health plan. And what that means is on October 1st, consumers will be able to access the health insurance marketplace and select a qualified health plan with that coverage that could begin as soon as January 1st of 2014. And when you're shopping online or in person or through the phone, consumers are going to be able to make informed decisions again about what the prices and the benefits will be, because it'll be available in clear terms so an individual can understand what options are available. And so with that, I'm going to turn a little bit to just what we're doing as an agency to help consumers enroll in the marketplace. And at the heart of our efforts is really working to ensure that we have the most effective and efficient customer service available to help individuals understand the health insurance marketplace and understand what options are available to them. We're really committed to customer service that's open and accessible to everyone. And so that could be what accessing help through online means. That could be accessing help through someone in person if you're talking to someone sitting next to you, or that could be simply accessing services through the phone. But from whatever variety you decide to access services, we're going to have that help available to you to take people through the whole application and enrollment process, and then also to provide some educational and contextual information along the way so you understand the health insurance terms and what's being made available. I do have some information and updates on some of our resources. Those are entities that you may have heard of, such as navigators, in-person assisters, or champions for coverage, a call center, and our relaunched website, which is Ohio's health insurance marketplace, which is healthcare.gov, as you mentioned earlier. As some of you may know, when it comes to in-person assistance, consumers in Ohio can get assistance from navigators and certified application counselors. And both of those programs will have trained and certified individuals across the state of Ohio who can help consumers understand their options. Last month, we awarded over $3 million to Ohio for their Navigator program. And in July, an additional $3.9 million was made available to 36 community health centers in Ohio. And they're also going to be available to provide in-person assistance. And in addition, we have a program called Champions for Coverage that's available for organizations who are interested in helping us educate and support our outreach efforts, but are maybe not necessarily interested in assisting in enrollment activities. Moving from some in-person assistance on the ground, we also have a marketplace call center that went live on June 24th. And that call center number is 1-800-318-2596. And we have customer service representatives available 24/7 via the telephone and an online web chat. Those customer service representatives can help assist consumers in English and Spanish. And in addition, we do have a language line that's available to assist callers in 150 additional languages at their request. During that open enrollment period, which is going to be October 1st through March 31st of 2014, our call center is going to assist individuals with a single streamlined application. And that whole process is going to include assessing your eligibility of plans through the health insurance marketplace, performing plan comparisons to help callers understand what their right insurance options might be and best suits their personal needs, address any issues related to premium information, and provide information on whether you're an individual or a family who might be eligible for financial assistance. And in addition, the call center is going to provide eligible consumers based on the information that they provide with contact information for the Medicaid and the Children's Health Insurance Program agencies in their state if that's needed. We do have a separate call center I want to mention for the Small Business Health Options Program, also known as the SHOP, and that went live earlier in August. And that program also launches on October 1st as a way to give small businesses new ways to provide health insurance coverage for their employees. And this SHOP Marketplace Call Center is a new resource to help small businesses get information about that program. It is open Monday through Friday from 9 a.m. to 5 p.m., and we will have expanded hours after October 1st, starting open enrollment. And we also have customer service representatives available on that call center in English and Spanish. And that call number is 1-800-706-7893. And moving forward, another area that I want to make sure that I provide an update on is our website. And because Ohio is a federally facilitated marketplace, that means that Ohioans will be accessing www.healthcare.gov. And that was relaunched earlier this summer with a new look and feel, and we've been getting a lot of really great feedback about the website. The focus of the website is really to help consumers and small businesses get ready to enroll in their new coverage. So the content right now is focused on educational information that's going to help consumers and small businesses learn about the types of coverage. And then starting on October 1st, they're going to be able to accept enrollment applications on that site. So right now, consumers are able to sign up for email updates or follow conversations that are on social media. And you can also investigate a wide variety of resources. We have a lot of resources available on the site, and that includes information on the importance of health insurance, insurance options, and health insurance basics. We also have that website available in Spanish, and it's available for individuals with visual disabilities. A few weeks ago, we added a feature to allow individuals to create a personal account in preparation for October 1st open enrollment kickoff, and that includes creating a username and a password so you're ready to go. When October 1st, the site will start accepting those applications for enrollment. And on October 1st, the online application will be available and accessible, and specific plan information will be available, so you'll be able to know costs for those individual health plans. And individuals, families, and small business owners will be able to go to that site and compare plans in their area. As a final note, I do want to mention that one of the questions I get a lot when I'm out in the field speaking in Ohio and across the country is I want to make sure that people understand that Medicare is not a part of the health insurance marketplace. So I want to confirm with individuals who may be on the call who are enrolled in Medicare that you do not need to take any action with regards to your Medicare coverage through the health insurance marketplace. They are not related. In conclusion, I just want to mention that implementing the health insurance marketplace and ensuring that we're open and ready for business on day one is a really exciting opportunity to make a difference in the lives of individuals throughout Ohio. And I really look forward to working with Congresswoman Beatty in the state of Ohio to ensure that eligible Ohioans get the quality health care that they deserve.
Okay, thank you very much. And please stay on the line as we have technical questions to help us. We're going to take a few of the health care questions, and then we're going to move on to our questions that deal with Syria. I think on the line we have Jim. Jim is on the line with a question. Okay, go ahead, Jim.
Hi, Congresswoman. Can you hear me?
Yes, I can hear you.
Okay, great. Thank you for the opportunity to participate and to pose this question. My topic is around the Affordable Care Act and jobs in the economy, so I'm kind of mixing these. So with reports that the Affordable Care Act and its many related regulations are raising health insurance premiums for middle-class Americans in most states across the country, and the administration issuing overreaching regulations, essentially executive orders through the APA, for example, all those hamper our small and large businesses alike. For example, coal in Ohio, that is huge. So in Pennsylvania, West Virginia, we are losing so many jobs that way and more to come. And employers generally are cutting back to less than 30 hours. There are reports that part-time hiring exceeds full-time hiring. So my question is, Congresswoman, and thank you, is there a plan to reverse these policies, which are devastating an already fragile economy? I'm really concerned that the country's going down the wrong path here.
Well, thank you, Jim. I think we have a lot of different opinions on that question. I think when you look at the Affordable Care Act, certainly we realize in this stage of information, as we heard from Michaela, I think we have to get accurate information. I think, first of all, when you look at the millions of individuals who are uninsured, that we have to have that as our top priority. I'm a small business owner, so I am very sensitive to the issues that are confronting some of the small businesses. What I have discovered in going out and meeting with a lot of them, they did not have available to them all of the accurate information. I do think we could have early on, we being government, done a better job of making things available. But what I do applaud the government with is they heard you, deciding that we would extend 1 year to also better educate, get information. I think that will help us. I think when you have to look at what they're doing with the business, small business is defined in this area, as we've heard Michaela say, is for those employers who have less than 50 people. I just did an example the other day looking at a small business and what they were paying now on their insurance coverage, where some of their members aren't even paying into their insurance, that they really are getting a better deal if they would go out and go through the marketplace. So I hear you, I understand you, but I think for me, we have to really look at how can we prevent illnesses, how can we keep people on the job, because that's the biggest thing for small companies, making sure that people are healthy and they can come to work. Thank you. And Michaela, is there anything you'd like to add to that?
Nope, I'm all set. Thank you.
Okay. We're going to take another question. Don't forget to make a comment or ask the question. We want you to press 0. Okay, we're going to take a question from Mark from Columbus. Mark, are you there?
Yes, Representative, thank you. Really appreciate you having this call this evening and the great update on the Affordable Care Act. I wonder if you might comment on Medicaid expansion. I realize it's a state issue now, and the state didn't put it in the biennial budget, but they're still debating it. I'd appreciate your thoughts on Medicaid expansion in Ohio.
Thank you, Mark, for that. And you are right, it is a state issue, but I am a proponent of Medicaid expansion and certainly applauded Governor Kasich for putting our application in to say that he wanted to receive those dollars for expanding Medicaid. Unfortunately, some of my colleagues over at the State House are not on board as fast as I would like to see them. Certainly, as you probably know, we need the General Assembly, or it would have to go on a ballot and become a ballot issue. While we do have some dollars to start the expansion in the state, Governor Kasich would not have enough dollars to continue with it. So it's a state issue, but if my voice can be heard on this, let's tell my colleagues over in the State House to move from center, and let's support our governor.
Next question.
Okay, we have a question that was sent in by email for someone who couldn't be, and that's Judy. Judy's question is for the HHS lady. She says she's a senior on Medicare, and what does she need to do to help health care coverage when the Affordable Care Act goes into effect?
That is a really great question. I just want to reiterate to seniors who are on Medicare that your Medicare coverage is not changing as a result of the health insurance marketplace. And so if you have coverage through Medicare, you don't need to do anything with regards to the health insurance marketplace. You have what we consider to be minimum essential health coverage. You have really great, robust health coverage with access to preventative services, and we're closing the donut hole for individuals who are enrolled in a Part D drug program. And so that's a really great question, and people are a little confused about that. So if you have Medicare, there are absolutely no steps that you need to take with regards to your health insurance in October as a result of the marketplace.
Okay, thank you. We will make sure that she gets that.
Wonderful.
And we have one more, and then we're going to move on to some other questions. We have someone named Christy, and Christy sent in a question that says, what are my health care options if I'm already covered?
Your health care options, if you're already covered, is if you have coverage through an employer, your employer plan or your spouse's employer plan. If you have coverage, for instance, through Medicaid or Medicare, as I mentioned, there are a variety of ways in which you can already have coverage. And in that case, you actually don't have to take any steps again during open enrollment. That health insurance marketplace is a really great way for individuals who are currently uninsured and don't have access to other types of health insurance. It's one more way for them to get information and access to affordable health insurance coverage.
Thank you. We're going to move on and now take a call from David from Bexley.
Hello?
David, are you there?
Yeah, hi. How are you doing?
Fine, thank you.
I had a quick comment and then a question.
Okay.
Sometimes it's hard to tell the difference between Democrats and Republicans when it comes to the Middle East because they kind of have a same knee-jerk reaction of we must blow stuff up. But I'd like to see a different strategy. And what's your opinion on the Syrian issue? We've had no luck at all in our war waging. So I think I'd like to see a different opinion, and I'd like to understand your opinion on this.
Thank you for your question, and in part, if it had to happen, I'm glad that going back to D.C. will be after I tell a town hall because I am soliciting comments from those constituents in the district. As you probably heard earlier and to the other callers, I've been spending a lot of time trying to learn and listen and hear the issues. This is very serious, and I'm very concerned about it. I can tell you that my reaction and when we vote next week won't be a knee-jerking one. It will be one based on getting a lot of answers that I don't think I have enough answers for now. I am pleased that the president did move from the previous position to come and engage members of Congress. I think in looking at the latest list that I saw this morning, most members are undecided. Now, I think people are undecided because we don't have enough information right now to answer some of the questions that we're going to have, like what will be the fallout or the fatalities? Who are we negotiating with? But I am comfortable that those questions, when we're back in official session on Monday's briefing and Tuesday, that we'll be in a better position to be able to say, this is not something I'm comfortable moving forward with, or this is something. But I can't give you a definitive answer today because I want to be fair. I want to hear from the rest of my constituents, but I can tell you constituents are calling our office. They are telling us, how they feel about it. For example, just in the last few days, we've received 273 correspondences on Syria. And I can tell you that the large percentage of those individuals have been in opposition to the intervention. Thank you. Okay, to ask the question, please press 0. We now have, I think it's Roche from Columbus on the line. Go ahead, Roche.
Thank you, Congresswoman, for having this meeting. I'm actually an Army reservist, and my question about Syria is, do you feel comfortable with the escalation strategy or exit strategy after the initial 60 to 90 days?
I can tell you that I am not comfortable with what I've heard because I have not received enough details to be able to say to us what happens, for example, when we go in with the Assad regime, and who are we negotiating with if, in fact, we are successful and that regime changes? Who's the next regime? What happens if we go in and it does not change and it only angers them? I'm not comfortable. I have enough information to know what's step 2 from what we're doing now. We've tried the diplomacy, and that didn't work. We are being told now that this is a political and not a military move. I make political somewhat akin to diplomacy, so I would be concerned if that fails. What is the backup plan? Is that backup plan to be implemented in 30 days, 40 days, or 60 days? These are all of the kinds of questions that I will be posing to the President and the Cabinet when we go in. But so you are helpful in asking your question, so I will frame that to them.
Thank you very much.
Thank you. Okay, next we have, where did that go? Okay, Jeffrey. Jeffrey says, I'm a social worker from Columbus.
Yes, hi, Congresswoman. How are you?
Fine, thank you.
Thank you for the opportunity to ask the question. It's back to health care, though.
Okay, that's okay.
I was wondering, I'm a social worker for a healthcare provider of dialysis services. We treat patients that have kidney failure, and these individuals are some of your most vulnerable constituents. They're usually elderly, low income, minority, and recently the Centers for Medicare has decided that they're going to propose a rate cut for payment for us, and the bulk of our patients use Medicare as their payer for the services. And I was just wondering if you would be willing to have a further conversation at a later date with members of our industry about possibly being an advocate on our behalf to the Centers for Medicare and Medicaid about that proposed rate cut, because that will impact our ability to provide the same level of care we've been able to provide up to this point, and it's effective January 1st of 2014. So we would like to have as many of our representatives to federal government in this area speak to Centers for Medicare and Medicaid on our behalf.
So let me just, on a personal, professional, and legislative point of view, say thank you. Years ago, I had an administrative assistant who was on dialysis, so I've had that experience of sitting with her during her treatments. We have received a number of letters into our office. Let me tell you, I 100% support you. I think that we do not have adequate Medicare funding, and I think it is so vital. I'm a healthcare advocate. I think we already fall short, and to have a cut of 12% or any percent from the program is unacceptable to me, because I think it hurts the hundreds of thousands of folks like you. So let me give you my phone number here, 614 area code 220-0003. We will be an advocate, and yes, we would be willing to continue the dialogue and to support you. Thank you so much for coming. Okay, I think we have Donald from Reynoldsburg.
Yes, ma'am. Glad to talk to you. Say, do you know anything about the concurrent receipt law when the military goes on retirement and then gets disability pay from the Veterans Administration? They require you to forfeit your military retired pay. In 2004, there was a law passed, concurrent receipt, and some of the people get their retired pay in addition to the disability pay. They took my retired pay all away from me, and I only received the disability pay. And they say because I work for the federal government that I am not entitled to it. And my question to you is, will you please take some action to get that law modified? Because there's a lot of people the same as me that do not receive their military retired pay. I served 21 years on active duty in the Air Force, and I'm 100% disabled, and I'm now 83 years old. I'd like to be receiving my Air Force retired pay. Will you please do something for get that law changed?
Let me say to you, Donald, yes, I think you're talking about H.R. 333, and let me just tell you that I am a co-sponsor already on that concurrent bill, and certainly I do understand it, and you've defined it well for me. It's called the Disabled Veterans Tax Termination Act. And I'm on your side with this, and I have already signed on to the bill. I will continue to advocate for you and folks like you because I agree. You should get those dollars, and I can tell you I'm going to be one of your biggest cheerleaders on this. So I appreciate your call because here's something I can say. I'm already working on it and signed on as a co-sponsor. So keep giving them hell, and we're with you. Okay, I think we have someone named Bob from Columbus.
Hello, Congresswoman Beatty. First of all, thank you for the opportunity to talk with you. And in addition to that, I do want to put in accolades for your case management section of your office. Your staff is absolutely awesome. The young lady, Veronica Brownlee, was just tremendous. So thank you there.
You're going to cause me some problems going overboard with that, but we also think she's tremendous, so thank you.
Well, at any rate, my question has to do with for example, I am a guardian for my older brother who is retired from a sheltered workshop and receives his medical benefits from that retiree system. And I was just wondering how the Affordable Care Act is going to impact people like him. He's now 71 years old, but people like him as well. And a second part of my question has to do with the myriad of baby boomers that are leaving the workplace today, and how it will impact them.
Well, let me start. And Michaela, are you still on the line?
I am still on the line.
Okay. Let me just say, when I look at the impact, and certainly Michaela is the expert on there, I think because of the program and the system he's in, he is covered or receiving Medicare because of the disability and his age. Some would say that it would still, just because you have insurance, you're not touched, that you're going to be fined for not having it because you have it. But on the other side, this just came up recently in my office when one of my staff folks said, but do we have the opportunity, even though we are covered, to still go to the marketplace to look at if there are opportunities for us to reduce costs? Michaela, would you kind of help me out on that?
Sure. So I would reiterate absolutely what you just said, that if your family member is enrolled in Medicare due to disability and or an individual's age, that again, there's no impact to Medicare coverage whatsoever. There is an individual, like for baby boomers who are still working and maybe not quite to Medicare age, they can continue to be covered through their employer. If they are not covered by their employer or spouse's employer coverage, they can go access the health insurance marketplace and see what options are available to them. And in addition, if you're, for whatever reason, even prior to the Affordable Care Act, if you're still working up to the age of 65 when you become eligible for Medicare, you would qualify for a special enrollment period into the program, and that would give you an opportunity to change your health insurance coverage. So all of those protections are still in place for baby boomers who are graduating into the Medicare program and might still be working, That would also still be true for individuals who are purchasing health insurance through the health insurance marketplace but age into the Medicare program. The health insurance marketplace's focus is really to help provide health insurance access to individuals who don't currently have insurance. And one of the reasons why I like to make that focus is that there are ways in which the health insurance marketplace might make coverage a little bit more affordable for individuals. You may have heard of the advanced premium tax credit, which can lower your monthly premium cost, or a cost-sharing reduction, which can help reduce your out-of-pocket costs, and that's all based on your income. If you're on the health insurance marketplace and you do have access to other types of health insurance coverage, you can absolutely still go online and look at the coverage options that are available. It's just important to note that you would not be eligible for the ways in which you might be able to lower your premium or out-of-pocket costs.
Thank you so much, Michaela, and thank you to the caller. Again, to ask the question, please press 0, and a person will come on and assist you. We have another question that came in from Tom. Tom says that he read something about the NCAA bill that Congresswoman Beatty is taking on the NCAA. Well, Tom, let me just say thank you for following the press and my bill. To the audience out there, I have a bill that's called the NCAA bill, and in some ways we are not necessarily taking on the NCAA, but what we're doing is standing up for those young athletes who are in contact sports. And basically what this bill does is 3 things. The bill that I recently introduced is a bipartisan bill. I introduced it with Congressman Dent, who's from Pennsylvania, and it's the National Collegiate Athletics Accountability Act. And basically what this is saying, you have these young folks who get a scholarship to play a contact sport. Many of them, especially from urban parts and rural parts of my district, come to a big city. They're excited. They end up pulling their ACL or getting hit, and they have a concussion. And then what happens? Oftentimes, someone holds up 2 fingers, says to the player, how you feel. That player is thinking about his scholarship, or is there a scout there today? They say, Coach, I'm fine. Just throw me back in the game. And too often, the end of the story is not something that you want to face when you're looking at that young person or their parents. The other thing that happens oftentimes is the scholarship that they've received, they lose their scholarship. And then we know what happens when a young person is in a new environment. They can't go to school even though they were matriculating. And oftentimes their due process is not something they understand. So the bill is asking those 3 things. We want to require annual baseline concussion testing, protecting the health of our students. It's quite simple. I would tell you that the medical folks agree 100% with us. I can tell you university folks agree with us on that. The next part is requiring the mandatory 4-year scholarships for athletes participating in Division I college, and it's all the contact sports, for them to fulfill the original intent as long as that student is matriculating. And then lastly, to require the NCAA to provide due process, meaning that they must let the students know when they're going to have a hearing and what the appeal process is. We are getting a lot of coverage. We're very excited about that, and we want to thank Tom for that question. Again, to ask a question, please press 0, and someone would help you. Okay, we have a caller on the line. We have the Reverend Dr. Johans on the line. Are you there?
Yes, I am, Congresswoman Beatty. This is Reverend Dr. Johannes Christian. It's good to talk to you tonight, and I really want to thank you for taking the time to have this town hall call. My question is regarding health care, and for people who have elected to stay home rather than being in a nursing home or assisted living, who have aides that come into their homes during the week, will there be coverage under the new insurance program through the marketplace.
Michaela, that's a little technical, and we have you on the line. Do you have an answer for the Reverend?
My answer would be that your health insurance coverage, whether that's through the health insurance marketplace or what your current health insurance coverage, often fluctuates from year to year. And so it's not going to be impacted necessarily by the Affordable Care Act, but simply by virtue of the type of health insurance coverage you have and what benefits that program is offering.
Thanks so much, and I hope that answers your question. Okay, we have several callers on the line. The next question is Jane from Gahanna. Jane, are you there? And I'm sorry.
I'm here.
Can you hear me now, Jane?
I can hear you. Thank you so much. Can you hear me?
Yes, I can. Thank you.
Great. Thank you. Actually, my name is Jean, but that's okay. My question is related to health care. I am the owner of a small business, and what I'm wondering is, should the individual plans have as good as or maybe perhaps better coverage at a better price than what I'm able to get for business providing insurance coverage? Is it allowable for me to stop offering coverage and, in essence, supplement my employees' salaries so that they can pay the premiums on their own and by individual? I mean, I know I'm not required to provide coverage. I do, but, I mean, is that an option?
Jean, I'd like to just say thank you, and we need to use you as a test model. If we had more people who are small business owners who would make a statement like that, recognizing you don't, but you take care of your employees so they can come to work and strengthen your business. I'm in a very similar situation. I would say the answer is no, you wouldn't have to continue if they then went out and got a better packet in the marketplace. But Michaela's on the line, and I'm going to let Michaela address that.
I think there's absolutely an option to you. I think my only advice would be that perhaps you might want to connect with some resources at the Small Business Administration who are really well-versed and knowledgeable. Obviously, their goal is to make sure that small businesses have the resources available to them or available to you as a small business owner. I commend you absolutely for providing health insurance coverage to your employees. And it may be a situation in working through the SHOP program that you might be able to find a way through that program to offer health insurance coverage to your employees at, for instance, maybe a lower cost than what you're currently offering as well. So there may be other options available to you at a lower cost that doesn't necessarily mean that you have to drop your coverage and supplement your employees' plans. So I think there are a variety of options available to you.
Thank you again to Jean, and thank you, Michaela, for that. Again, to ask a question, please press 0, and someone would help you. I think we have a caller on the line, Stephanie from Columbus.
Yes. What I would like to speak about first is Syria. I think that it should be might as well say dissected. This is very serious, and it affects everyone. So I think that everything should be thoroughly checked out because my faith and other people's, as well as other things, that's as far as I'm going to put it, could be on the line. And they're using chemicals. So since they're using chemicals, really do some research because they may try to send them chemicals also elsewhere. I'm a veteran. The next thing I would like to talk about briefly is the young man on the telephone who spoke about the way we get our payments. They are not formed right yet. I'm just now recently getting involved in the medical system at the VA. I was working. Then I ended up sick and on SSI from things that happened to me in the military. And then from there, I was put on a connection pension, and now I'm supposed to have to go through some more stuff for a connection pension. Meanwhile, I need certain care out of my pocket that I have to spend, which I feel is not fair. And when I listen to you, as well as the young lady on the phone earlier, it is not easy for me to speak or to talk, but I do a lot of listening. And what I heard was your heart. And when I hear that people are interested in individuals, also I'm talking about work sites and whatever, but an individual. And that's what it's about. Education, I'm for all of that. And a lot of these young students and children, they need, I'm going to keep it real because that's me. They need help. They need some love. They need to be tested as well as some of their parents. And then they need to be helped. What it's about is people stop talking about coming together, doing this, doing that. A lot of talk. Show some action. That's what America first needs to see. We hear a lot of talk, but then we say, make a move. Now, what I heard on this phone tonight, I believe you. And
Thank
I believe
you much,
and
Stephanie.
I believe the other young lady. And I've also been a foster parent as well as other things. But I can't say me. I can say the strength in me and the love in me. That
Thank
love.
you very much. We're going to have another caller come on, Stephanie,
and that's all I had to say.
I want
and
to
thank you for listening.
Thank you. And I wanted to have time to respond to you, Stephanie. I wanted to tell you thank you because so often we don't hear from that citizen out there that wants to share his or her views with us. And I appreciate the personal comment, and I am trying to listen to my constituents so I can speak from my heart. And I want to thank you for what you're doing and tell you that we will continue to advocate for you and those who are in the system. Again, if you would like to ask a question, press 0 and someone will help you. I think we have a caller on the line. We have William from Canal Winchester, I believe.
Yes. Hello, Congresswoman Beatty, and thank you for hosting such an informative conference tonight.
Thank you.
My question is in regards to health care. I know Michaela had said that there is an open enrollment coming in October. Will there be an annual open enrollment after the October open enrollment? And then also, could she speak more about pricing? How is the pricing determined in terms of the premium rates that will be rolling out in October as well?
Okay, Michaela, can you help William out with that question on the pricing?
Sure. I have to be honest with you that, we don't know the exact, well, I personally don't know the exact prices. Someone in my central office who's helping review those plans absolutely does. But the information on the exact prices of the plans, the deductibles and monthly premiums, et cetera, will be available publicly on October 1st. And I know that that's the day that the open enrollment kicks off, so I just want to reiterate that we have a wide amount of time for that first open enrollment period. So it does start October 1st, but for this first year, it's extended out until March 31st of 2014. So we want to make sure people have a lot of time to go browse those plans and understand what the costs are associated with them. So I can't necessarily give you dollar amounts on what the ranges of premiums will be in Ohio, but just simply that they will be available publicly on October 1st. Would you like me to address the open enrollment moving forward question?
Yes, please, because I think there is an open enrollment.
There absolutely is. So the very first year, as I mentioned, is October 1st, and it's going to run through March 31st of 2014, just for a 1 year only to make sure people have an adequate window to understand what's going on, because we know this is the first time a lot of individuals are going to be accessing health insurance. Moving forward, the open enrollment will be October 15th to December 7th. And that will continue every year throughout the program.
Okay, thank you, and thank you, caller. Again, if you would like to ask a question, press 0, and someone would help you. Also, we're going to take, I believe, one more question, and if you have a question or think of a question later, please leave a message with us, and my office will follow up with you individually. Again, our office number is 614-220-0003. We're at 471 East Broad Street, and we're also at 417 Cannon Building, Washington, D.C. We have a call that came in by email, Pam from Columbus. Pam's question is, Congresswoman, I followed you during your time in office at the State House, okay, and you worked on several housing there, including public housing. Are you still working on housing programs while you're in Congress? Well, Pam, I don't know if you're listening, and if not, we will send this answer to you electronically. The answer is yes. I mentioned that I'm on the Financial Services Committee, but the subcommittee, which is housing, is a committee that I serve on, and I've been very vocal there. I have also signed funding letters for grants that would provide funding to organizations that provide affordable housing. And the last day before I left for our August recess, I actually introduced a new bill that's called New House. And basically, it is a bill that will allow funding from the state's Small Business Credit Initiative to provide affordable housing funding. Not only will this create greater access to affordable housing, but I believe it will also spur our economy. So I am continuing to work and serve on housing, advocating that we continue to have things like FHA, where a number of us got our first housing loan. Let me just say our teleconference is coming to a close. I am very appreciative for the hundreds of folks who have been on the call listening. I'm very appreciative to the number of people who did dial in and have a question. Again, this is Congresswoman Joyce Beatty, the 3rd Congressional District. And this was our very first tele-town hall meeting. And I'd like to say to all of our constituents, thank you, and to let you know that we're going to do this again. So look for those phone messages and emails, because our next tele-town hall meeting will be early November, and 60 days after that, we will announce our town hall meeting. Once again, our in-person town hall will follow our November teletown hall. Thank you for all of your questions. More importantly, thank you for your support. Thank you for continuing to give us information that will